So I've talked with the family, the mom and dad whose daughter's been diagnosed with cancer. I have talked to the young woman whose mother has just been diagnosed with diabetes. I've talked to the young man who has MS.
So I don't know. It's funny. Like, I don't know how anyone.
Hey, if we go have those three conversations, we can be as qualified as she is to talk about it.
I guess so. But how does any like adult person? I guess it's just a different world. People who listen to podcasts like this, and I don't even mean just this and people who agree with us politically, but even anyone who listens to Rogan or listens to like any of these like kind of more long, in-depth podcasts where people discuss these things. I just don't see how you don't see through this. It's like, hey, so you haven't addressed how you're going to pay for this plan. Well, I talked to the mother whose daughter is, worried about her, flu shot and all these things. Like, wait, what? Isn't this just obviously being evasive? And and this is what she says. Costs for rich people will go up. Costs for not rich people will go down. Leads to so many questions. We'll get into some of them. One of the big ones that's really unbelievable, and it's weird, like just hanging out at, say, the Soho Forum debate, right? Which is a debate series that the great Gene Epstein runs here in New York. We've got, I don't know what it is, like a few hundred people who come into each debate. And it's a great like little event that Gene runs. And this is for the commander-in-chief, the biggest thing ever. And if anyone ever started going down the line that she goes in, she says this over and over, no moderator, no other candidate on there asks what would be, I think, a follow-up question that there's no way you'd get out of a Soho Forum without being asked. You go, the rich are going to pay more, the not rich are going to pay less. Well, what's a pretty obvious follow-up question to that? What's rich? What's rich? It's just something that sounds nice. What do you mean rich? What's rich? Is making $100,000 a year rich? How about making 200, 500, a million, 10 million, 100 million? Like, where do you draw the line of what rich is? So it's because, by the way, this is something that, anybody who's never been in that, any of those brackets doesn't understand, but there is really the difference between someone who makes $200,000 a year and someone who makes $1 million a year. It's a very big difference. It's a very big difference. It'd be the same as looking at someone who makes, $20,000 a year and someone who makes $50,000 a year and being like, oh, all the same. Organized. That's a big difference, man. A very big different thing. So, Joe, just curious, if you're going to say only rich will provide for, where is that? And show me exactly how the numbers work out on this. This, of course doesn't happen. But anyway, so that was her answer. The rich will pay more. Everybody else will pay less. Here's these three people I talked to. Let's continue with Elizabeth Warren.
Here's the thing about all of them. They all had great health insurance right at the beginning. But then they found out when they really needed it, when the costs went up, that the insurance company pulled the rug out from underneath them and they were left with nothing. Look, the way I see this, it is hard enough to get a diagnosis that your child has cancer, to think about the changes in your family if your mom's got diabetes, or what it means for your life going forward if you've been diagnosed with MS. But what you shouldn't have to worry about is how you're going to pay for your health care after that.
Senator Warren, to be clear,
Is that true? And if that is true, then you guys should probably stop forcing us to get health care, because apparently when you need it, it doesn't actually cover you.
Yeah, I guess Obamacare really wasn't that great if these are the programs that are all
is
kind
that,
of under
Is that a thing that happens to people?
No, I mean, I think it's greatly exaggerated. I'm not saying there's not cases where insurance does some shady things, but usually, it's like there are certainly deductibles and premiums with insurance, and you get all of that information up front and what you're covered for, and sorry, you got to look into it. Look, man, this is pure propaganda, and it's propaganda, and this is what I hate about left-wing domestic politics in general, is that it's always this kind of like, it's like the same complaint I had last show when we were talking about the CNN anchors who's like, words are important. And you're like, who the fuck do you think you're talking to? You're talking to a child right now? No, words are important. Give me the news. I don't need your fucking kindergarten lecture about how feelings matter. I'm an adult. And, it's like you say these things that emotionally are soft and they kind of appeal to the child in you. Like, you already found out someone's sick. You shouldn't have to worry about how to pay for it. Well, why? I mean, things have to get paid for. Things have costs, okay? Now, by the way, even if you're going to tax people and then the government is going to pay for things, you still have to worry about how you're going to pay your taxes. Costs don't go away. Hospitals have to be built. Hospital machinery has to be built. Doctors have to be paid. Nurses have to be paid. The lights got to stay on. Okay? There's a lot of things that go into, medical care that are costs. These things, they like, forget the money, forget the currency, take that out of it. It takes time and effort. That doctor had to go to school for years and years and train. These nurses have to leave their family. They have to go to school and train in many cases. Like it's like things cost money. Somebody built that hospital, like hard manual labor. This cost things. Okay. Now you could certainly argue that the costs in medical care are out of control, and you don't want somebody to be sick and have to worry about anything else. You don't want somebody to be sick and have to, it's a nice idea that people shouldn't have to worry. And certainly you don't want people to be bankrupted over things and the costs to be dramatically inflated. And then we could talk about what actually reduces costs and what the problem is here. Quick answer, it's the market. But it's like saying well, I just had a kid. I'm dealing with having a child, bringing a child into this world. I shouldn't have to worry about how to pay for her shoes. It's like, well, it kind of sounds nice in some childish way, but actually, yeah, I should. It's exactly what, because otherwise someone else has to worry about it. Someone's got to pay the fucking cost.
There's no shoe fairy.
No shoe fairy, no roads fairy, no medical insurance fairy.
The other thing that really annoyed me in this insurance conversation, it comes up a little bit later, and they start talking about all the profits of the healthcare industry, and they go, how is it that they're so profitable? Well, it's a lot of licensing laws. A lot of that is since Obama. It's since you've taken certain insurance and competitions out of the market.
Well, the profits went up.
Yeah.
After Obamacare. So, I mean, there is that. I mean, it's like, yeah, there's a lot of reasons why they profit, but it's just wrong to even conceit the idea that profit is a problem. Oh, why would people profit off of medical care? Well, as in any voluntary interaction, just because somebody profits doesn't mean it's somebody's loss. This is like fixed pie fallacy 101. Just because somebody profits doesn't mean that anybody else loses. That's like, anytime you buy anything, the person who you buy it from profits. I mean, unless they're selling it to you at a loss, but let's just say the majority of the time people who are in business or staying in business are not selling at a loss. They're making a profit, but that doesn't mean every time you buy something you lose. You're making a voluntary decision to buy it. So obviously you're at least expecting to win. It's not like, if I go buy beer at the store, they profit off that beer, but I'm not just like, oh my God, I just lost. I wanted beer. I got what I wanted. We both won. That's what voluntary exchanges tend to lead to. So it's very misleading. But anyway, Elizabeth Warren asked, back to the point, which was that, no one should have to worry about costs, but rich people will, and they'll pay more costs. Everybody else will pay less.